grade 12 student, and I'm going to report about anxiety and depression. Alam naman natin ngayon na ang pinaka-common na sakit, lalo na sa mga kabataan, ay ang anxiety at depression. Ano nga ba ang anxiety at depression? At saan ito nakukuha? Unahin natin ang anxiety. Anxiety is a feeling of worry, nervousness, or unease, typical about imminent event or something without uncertain outcome. For what I've heard, anxiety thinking about present or worrying about future. This is the some common symptoms of having an anxiety. When you're feeling nervous or tense, having a panic attack, increased heart rate or pagbilis ng tibok ng puso, hyperventilation or hard to breathe, sweating and trembling, feeling tired or yung tipong kahit wala ka namang ginagawa ay laging pagod or pagod na pagod ka, trouble concentrating or thinking about anything. A big event of a build-up smaller stressful life situation may trigger excessive anxiety. For example, seeing dead person, where stress or worrying about financial and personality. People with certain personality types are more prone to anxiety disorder than others. Where does having anxiety came from? O saan nga ba nagsisimula ang pagkakaroon ng anxiety? Anxiety began when you have a difficult experience in a childhood, adolescence, and adulthood. These are the common triggers for anxiety problem. Going through stress and trauma when you're at very young age is likely to have a big impact. Experience which can trigger anxiety problem, including things like physical or emotional abuse. Who invented anxiety? O sino nga ba ang naka-invento nito? In April 1869, a young doctor in New York named George Miller, writing in a Boston Medical and Surgical Journal, coined the term for what he believed to be a new, distinctly American application. One he had seen in 30 of his patients, neurasthenia. From the word neuro, it means for nerve, and asthenia in a word for weakness. Can anxiety be cured? O nadadaan ba ito sa gamutan o may gamot ba dito? Actually, anxiety is not curable, but there have a ways to keep it from being a big problem. Getting the right treatment for your anxiety will help you dial back your out-of-control worries so that you can get on with a life. Anxiety statistics worldwide shows that anxiety disorders are commonly across the globe according to the World Health Organization. That there has a 3.6% or about 664 million individuals in the world that have an anxiety disorder. Grabe no? Ganun na pala karami ang nagkaroon ng anxiety. Isa ka na ba doon? This is the type of anxiety disorder. First, generalized anxiety disorder or GAD is an anxiety disorder characterized by chronic anxiety, exaggerated worry, and tense, even when this is a little or nothing to provoke it. Second, obsessive compulsive disorder or OCD is an anxiety disorder and it's characterized by recurrent unwanted thoughts, obsession, and or repetitive behavior compulsion. Repetitive behavior such as hand washing, counting, checking, or cleaning are often performed with the hope of preventing obsessive thoughts or making them go away. Performing this so-called ritual, however, provide only temporary relief and not performing them markedly increased anxiety. Third, panic disorder is an anxiety disorder and is characterized by unexpected and repeated episodes of intense fear accompanied by physical symptoms that may include chest pain, heart palpitation, shortness of breath, dizziness, or abdominal distress. Fourth, post-traumatic stress disorder or PTSD is an anxiety disorder that can develop after exposure to a terrified event or ordeal in which grave physical harm occurred or has threatened. Traumatic events that may trigger PTSD include violent personal personal assault, natural or human caused, disasters, accident, or military combat. Social phobia or social anxiety disorder is an anxiety disorder characterized by overwhelming anxiety and excessive self-consciousness is everyday social situation. Social phobia can be limited to only one type of situation, such as fear of speaking in formal or informal situation or eating and drinking in front of others. This is the sum that you can do to prevent anxiety. Take care of your body by eating a well-balanced diet, included a multivitamins when you can't always eat right. Limit alcohol, caffeine, and sugar consumption. Take time out Take time out for yourself every day, even 20 minutes of relaxation or doing something pleasurable for yourself can be restorative and decrease your overall anxiety level. Trim a hectic schedule to its most essential items and do your best to avoid activities you don't fix relaxing. Keep an anxiety journal. Rank your anxiety on a 1 to 10 scale. Note the events during which you felt unconscious and the thoughts going through your mind before and during the anxiety. Keep track of things that make you more unconscious or less unconscious. This is the sum effect of having anxiety. A churning feeling in your stomach o pakiramdam mo na parang bumabaliktad ang iyong sikmura. Feeling lightheaded or dizzy o nakakaramdam ng pagkahilo. Pins or needles, nakakaramdam ng pagkirot o tumutusok sa iyo. Feeling restless or unable to sit still, hindi mapakali. Headaches, backaches or other aches and pains. Sumasakit ang ulo o ang katawan. Fast breathing, mabilis na paghinga. A fast thumping or irregular heartbeat, mabilis o mabagal na pagpintig ng puso. Sweating or hot flashes, pagpapawis. Sleep problems o hirap sa pagtulog. Grinding your teeth especially at night. Yung pagpapatunog mo sa ngipin. Nausea, feeling sick o nakakaramdam ng pagsusuka. Needing the toilet more or less often. Yung ihi ka ng ihi o kaya nakakaramdam ng minsan lang na mag-CR. Changes in your sex drive and having panic attack. This is the sum of causes of having anxiety. The causes of anxiety disorder aren't fully understood. Life experiences such as traumatic events appear to trigger anxiety disorder in people who are already prone to anxiety. Inherited traits also can be a factor. I'll show you some videos of having an anxiety attack.
The first thing you should do when someone is having a panic attack is listen. Although the person having a panic attack may not be able to immediately verbalize what they need, if they can tell you are ready to listen to what is going on and how you can help, you won't even need the rest of this list. You can just do whatever your loved one tells you they need. Another thing you can do for a person experiencing a panic attack is letting them know you care. A way to communicate this for most people is just putting an arm around that person or hugging them. This is the way your friend has physical evidence that they are not alone, to combat the physical messages of panic that their body is producing. Obviously, only do this if you are there with that person. What I mean is that this is definitely not the time or place to make an acquaintance or a friend even more anxious with an unwanted hug or inappropriate affection. Finally, show that you are truly supporting them by looking your friend in the eye. Eye contact can go a long way in expressing to the person that you are with them. This does not mean staring at them silently. This may give the appearance that you are shocked or scared. The last thing they need is for their friends around them to panic. Warm, supportive eye contact, along with appropriate touch and affirming words, will give a person experiencing a panic attack what they need, which is to know that you are concerned and that someone that cares is present with them, not just physically, but emotionally as well.
At ngayon, alam niyo na ang gagawin kapag kayo naman ang nagkaroon ng anxiety or even meron kayong kakilalang anxiety, pwede niyo siyang matulungan sa pamamagitan ng mga nabanggit ko. So, dahil tapos na tayo sa anxiety, let's talk about depression. What is depression? Ano nga ba ang depression? Depression is a common and serious medical illness that negatively affect how you feel, the way you think, and how you act. Fortunately, it is also treatable. Depression causes feeling of sadness and or a loss of interest. Interest in activities you once enjoyed. It can lead to variety of emotion and physical problem and can decrease your ability to function at work, at home. Depression, actually thinking about the past. This is the some symptoms of having a depression. Feeling sad or having a bad mood. Loss of interest or pleasure in activities when you enjoyed. Changes in appetite, weight loss, and gain unrelated to dieting, trouble at sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activities like inability to sit still, pacing, handwriting, or slow movement or speech, feeling worthless or guilt, difficulty thinking, concentrate, or making decision, thoughts of death and suicide. What is the causes of having a depression? Depression is a complex disease. No one knows exactly what causes it, but it can happen for a variety of reasons. Some people have depression during a serious medical illness. Others may have depression with life changes, such as move or a death of loved one. Still others have family history or having depression. Those who may have depression and feel overwhelmed with sadness and loneliness for no known reason. It was 19th century German psychiatrist Emil Kraepelin who began revealing the various forms of melancholia as depressive states due to the low mood that defined it. Kraepelin also took a dual approach to mental illness, separating depression into two categories, manic depression and dementia praecox. Kraepelin's distinction was based on whether the depression's source was external or internal. If the depression was caused by an external tragedy, such as the death of loved one, it may be considered a form of manic depression and extended to the episodic and passive. However, depression that did not stem from known external causes was understood to having grown out of the individual's psyche and such was considered a break from reality that is similar to present-day schizophrenia. The distinction Kraepelin made between both types of depression is still relevant today. Many patients continue to recount how people are more willing to offer sympathy if the source of their depression is clearly understood, as such as individual whose depression was caused by witnessing a traumatic event is likely to receive more social support than someone whose depression appearing during adolescence. Like anxiety, there is no cure for depression, but you still have plenty of options for treatment, all of which can improve your symptoms and minimize their impact on your daily life. You might think, but if my symptoms go away, that means I'm cured, right? No, exactly. Symptoms might ease you to the point where you're able to return to your usual routine, but you could still notice lingering changes in your mood and mindset. Plus, depression often happens in episodes, so it's possible to have another episode later in life. Below, you will find details on expert recommended treatment for depression, complementary and alternative approaches, and emerging treatment plus tips to help prevent recurrency. This is the effect of having depression. You may feel tired all the time or have trouble sleeping at night. Other symptoms include irritability, anger, and loss of interest in things that you used to bring pleasure, including sex. Depression can cause headaches, chronic body aches, and pain that may not respond to medication. This is how to prevent of having a depression. Exercise regularly. Lagi mag-ehersisyo araw-araw. Example, mag-yoga to peace your mind and mag-jogging. Cut on social media time. Tumigil or iwasan ang paggamit ng mga social media tulad ng Facebook at iba pa. Build strong relationship. Minimize your daily choices. Reduce stress o umiwas sa mga stress or nakaka-stress sa'yo. Maintain your treatment plans. Get plenty of sleep. Matulog ng maaga. Stay away from toxic people. Umiwas sa mga taong hindi nakakabuti sa'yo. Eat well, kumain ng marami. Maintain a healthy weight. Manage chronic condition. Reduce alcohol and drug uses. Tumigil sa pag-iinom or paggamit ng droga. Get off nicotine. Nicotine?
Nicotine?
Get off nicotine. Plant off unavoidable non-triggers. The end of my reporting. Thank you for watching.